Good morning.
Good morning.
We are at APICON 2022 at Jaipur, and I am lucky to have with me one senior consultant geriatrician from Kerala, Dr. Sajesh Asokan. Welcome, Sajesh.
Thank you, sir.
Dr. Sajesh, there is a very high percentage of literacy in your state, as well as high percentage of elderly people also in your state.
Yes.
Is that true?
Yes, that is true.
In elderly, do you promote preventive vaccines?
Yes, we do. We do on a regular basis.
Which are the vaccines you promote?
The two commonly vaccines which we promote are the flu vaccine or the influenza vaccine and the pneumonia vaccine or the pneumococcal vaccine.
What is your experience in elderly people with comorbid conditions and the use of vaccines?
We encourage our elderly patients and those with comorbid conditions to take both the influenza vaccine as well as the pneumococcal vaccines on a regular basis. At each encounter which we have during their visits to the OP, we check their vaccination status, whether they are due or whether they have taken their vaccines. The influenza vaccine, as you know, is taken on a yearly basis, and the pneumococcal vaccine, it is taken almost on a 5-yearly basis. The second time that we check on this, or we encourage or we give the vaccine, is when the patient is admitted and he is about to be discharged. So as a pre-discharge procedure, we advise and we often give the patient both the vaccines.
I hope you continued this practice during the COVID pandemic also?
Yes, during COVID times also, though there were doubts in the patient's minds regarding this vaccines, it gave us an opportunity to present these vaccines and in fact promote these vaccines to the elderly population, and we found it very effective in COVID also, because COVID infections or COVID infections subsequently develop secondary infections.
So do you believe that these respiratory vaccines will improve the respiratory hygiene among elderly population?
Yes, we can see a downtrend in the rate of admissions in the patients who have taken vaccinations, especially as far as respiratory issues are concerned.
Do you think this will help also in their comorbid conditions?
Definitely, it will help improve their comorbid conditions also, because as we are all well aware, any sort of infection precipitates or worsens any comorbid condition that the patient has.
So friends, we have the first-hand experience from Kerala also, from an allied geriatrician who believes that COVID vaccine and the other respiratory vaccines in elderly will improve their respiratory hygiene and will be of great help in managing their comorbid conditions also. Thank you very much, Sajesh.
Thank you, sir.
Thank you.
Thank you.